Are we live? I think we're live. Okay, sorry. That's not a good sign. You can't even get connected. So another live edition from Omaha Spine and Sport Friday. Sorry. Today we're going to kind of be talking about, like we introduced last video, if you watched it, the hashtag Chiropractic First. It's the big campaign for the American Chiropractic Association. October is National Chiropractic Health Month, so we're trying to go along those lines, maybe go away from what we normally do. We're always talking about chiropractic, but it's a little bit more focused this time. It's a safer alternative to opioids. So chiropractic is a big push in chiropractic is trying to change the pain management strategies that we've kind of gotten into with the opioids, the medications, the Percocets, the Vicodins, hydrocodone, and then basically offer non-pharmacological approaches like chiropractic physical therapy. So I think we can kind of come in the pain management solution as a very viable option for patients, whether they haven't started opioids yet or whether they're on opioids and it's kind of no longer working, which we'll talk about that later.
Right.
I kind of saw this firsthand at the Des Moines VA in the pain management program where I was an intern, and a lot of times they were trying to take people off of opioids because they weren't effectively managing their pain, and then add in other things like chiropractic, acupuncture, which we offer here. And that's kind of the new pain management solution.
Right. Plus pain education research. There's two different types of pain management programs out there. There's pharmacological and there's non-pharmacological. That's a mouthful to say. And there's a big push for the non-pharmacological right now, just because they're finding that these chronic, extended narcotic, opioid type pharmacological plans are kind of ruining lives. And you don't know what you don't know sometimes, and they're finding out more and more about what opioid medications and some of these narcotic pain management medications can do long term, and overall it's not good. So if you are recommended to do a pain management program, you need to ask your provider if it's pharmacological based or non-pharma, because there's a lot of research in the pain world right now that's not pharmaceutically driven. So if you can find some place that you can go that's non-pharmaceutical first, you're going to be a lot better off. And that's where we kind of come in, and what we see, there's two different types of people that we see here, and unfortunately we see more of the latter that I'm going to talk about than the first one I talk about, and that's people that are seeking conservative care first because they don't want to do medications, they don't want to do drugs, they don't want to do injections, like they are completely non-medication based. And so we'll see a fair amount of those people here, but unfortunately what we see here, and it's just kind of the environment of, and just maybe even the Midwest, is that we're very Western medicine based here. You go to your primary care, you have back pain, typically you're prescribed some sort of an anti-inflammatory, possibly a muscle relaxer, and if that doesn't work, then they go with the opioid medications. If that extends out too far, then you get referred somewhere else that's more specialized in spine care, like a surgeon or something like that, and then we get those people down the road. I just had a workers' compensation case in here where he's about a year out of the initial injury, and I'm getting him kind of on the tail end. We'd really like to see those people sooner than that, because there's a spectrum of this medication use that gets very difficult for us to make big changes, at least immediately. It's just a longer treatment plan for us. We can still help these people immensely. It's just that we're facing an uphill battle at the very beginning, because they've gone through all of these things. They've been on opioid medications for a long period of time. They've done injections, physical therapy. Like, they've kind of failed the opposite end of the spectrum before coming here. So we see both types of groups of patients, and we can tell you that the earlier we get you in that spectrum before the medications, the much better your prognosis. At least it's a lot faster turnaround.
I think that's the big push, right? The chiropractic first. Like, we want to be first line, front line management, and then if they try what we have to offer, and they try physical therapy, and they try acupuncture, and they've tried the analgesics, the pain relievers that are non-opioids, then it's appropriate. Like, we're not demonizing opioids. Like, they are appropriate for some pain management. It's just that, like Corey alluded to, the order, it's so screwed up in the order. Like, we see them way too far on the back end, and that's the big push within chiropractic, is offer what we have on the front end. And then what we imagine we'll see, and we've seen so many times, is that then they don't get that far. They don't need the opioid therapy. They can manage it with chiropractic, a non-opiate analgesic like an NSAID, and then it just decreases all that other stuff that comes with opioids, all the crazy side effects. For example, overdose deaths, including prescription opioids, have quadrupled since '99, as have sales of these prescription drugs. So as we sell more of these, we see parallel overdoses just happening. We need to prevent people from going from a prescription of opioids to a full-blown addiction, right? In acute low back pain, what we know is that chiropractic is very, very effective. Like within the first 16 days, we have unbelievable results, but we don't ever get the chance to prove that a lot of times is because we don't see those patients until 2-3 months after they've already on opioids, and then we're kind of fighting an uphill battle.
A lot of this information comes from a white paper that was written. It was released probably a month or two ago.
Yeah, I think so.
And it's not just from an entirely chiropractic slant. It's more from just an overall opioid overuse kind of general information, to the point to where a lot of this was started by the CDC when the CDC said that the opioid use is not meant for long-term management of pain. It's meant for very short-term periods of time to get you out of pain so that you can do some of these other things. And the numbers, the pharmaceutical, the numbers of from this paper are just absolutely mind-blowing, as far as like the overuse and abuse of opioid medications has gotten to be such a problem that now, like, even the CDC is stepping in and saying, hey, we can't do this because we're ruining lives. And it's become more about making money and creating addictions to some sort than it is about helping people. And this white paper it's like 27 pages long, but it's not just from a chiropractic standpoint. We're not, again, demonizing opioid use. There definitely is a time when we need it, especially in the acute phase. We'll refer out for certain anti-inflammatories, Medrol dose packs, those kinds of things. And we try to avoid the opioid medications, but there is a time when it's definitely beneficial, but it's for a very short period of time, and people are using it for long periods of time and creating these addictions, and it's killing people, and it's unfortunate. And this is just for general information, and this information's out there. You can search the white paper on opioids.
We actually I posted it from our Facebook site, right, kind of announcing when we were going live. So you can click on that link. It's actually released from the Foundation for Chiropractic Progress.
Yep.
I kind of outlines, this is the problem, these are the numbers, this is what the CDC says, and then kind of swings it like, hey, this is what we have to offer from the chiropractic profession, or from just the conservative care realm.
Right. And we're not going, this is not a full-blown attack on medications or pharmaceuticals or the big pharma or anything like that. There's plenty of that out there. You can research it, and you can find all kinds of cool videos and stuff. Well, basically what we're saying is we'd like for the general public to know that we should hopefully try to make a shift of conservative care first, and then we can start to get more aggressive with medications and injections and things like that. Right now what we see, it's kind of flip-flopped. Like, we see people that go that route first, and then as a last-ditch effort come to see us. And that's, we're more than welcome to do that, and we're more than willing to try. It's just going to be, you have to realize that you've kind of gone backwards in that progression, and it's going to be a little longer for us to be able to make these adaptive changes that we need to make. And we'd like to see you up front, because we feel like we're really well fit to triage, meaning we can go through your evaluation and figure out what it is and where you are in that spectrum, and if we can help, it's great. If not, we can get you to the right people. And that's what we would like to just kind of let the general public know, that we are very good at triaging patients, and we're not so conservative minded that we're just going to treat you regardless of what we find, but we're going to treat you if we can help you, and we're going to get you to the right people if we can't.
And another big point is that, and that what the CDC backs up, is it's never only opioids. Like, if that is your only form of treatment that you're doing, well, that goes against what the guidelines and what the CDC says. So if you're on those medications, that gives us a great opportunity, a window to keep you moving, because ultimately the purpose of the opioids is to get you to be more functional, whether it's go to work, do the things that you want to do, because we know, and we kind of talked about it in the non-specific low back pain one, which is on our YouTube channel, which you should check out and subscribe to, is that,
nice segue.
Yeah,
for yourself.
So now I'm off, though, so not a good segue. We never want to only do opioids, because we know that, like, the bed rest, just being very sedentary, and just taking the medication is not effective. So that's kind of one of the prerequisites before you getting on opioid therapy, is there needs to be a failure of conservative care. We need to have where are we before starting the opioids, like functional baselines, and we take those in the office all the time for our own use, and then revisit them after the 6 to 8 visits. That's why we treatment plan here. So I think that's a big thing. So even if you're on opioids, you've kind of gotten that far, maybe they're completely appropriate, you should never just be on opioids. You should always be doing something else, whether it's chiropractic or physical therapy or a home exercise program, which we give our patients all the time. So we want to keep you active, because that's the point of opiate therapy: decrease pain but increase function.
Right, and that's the ultimate goal. Like, you know, is to get you as healthy as possible. And health has a lot of different factors, and never in a healthy lifestyle is opioid medication included. It's proper rest, it's, you know, stress management, it's eating right, drinking right, use food as medicine and food as fuel, not as an escape, and you know, conservative care, and keep moving, you know, exercise, those kinds of things. That's health, not more medications, and that's kind of what we're after. We're not here to lambast the pharmaceutical industry. We're here just to let you know that we're that conservative care option that's out there, and we can't prescribe your drugs. It's outside of our scope of practice, so we can't take you off of them, we can't put you on them, which I'm glad that we can't do that. I personally don't want to deal with that. It's a whole different whole new bag of worms that you don't really want to open sometimes. So if you have questions, you need to ask your primary care, or find a good pharmacist. They're the people that really understand what medications go with what other medications. Sometimes we see this mixing of medications, and some medications don't mix well with others. And so find a good pharmacist that you can talk to, or somebody that knows something about the medications that you're on. And from a conservative care standpoint, you know, this is a good place to start. We have a lot of options here in our office. We have 3 chiropractors with different subspecialties in different areas, an acupuncturist, and we're going to add a massage therapist here in about a month. So we have a lot of good input, and we have a lot of different perspectives that, you know, we wouldn't necessarily, you know, we all look at problems just a little bit differently. So it's a good place to start. Or if you need a reference, you're more than welcome to contact us. We're here to share information, not say that we're the end-all be-all of conservative care.
Right. Kind of bottom line, our why, we want to be a patient advocate for you, whether that is with the opioids, without opioids, finding a provider if we can't help you, or kind of going through the different providers and specialties here in our office. Yep. So let's go into the sports pick'em.
Nothing for Nebraska. I was wrong. They did not do the 45-7 thing last week. So we'll talk about Indiana coming up next week. We really only have. I had to look it up because Chadron State's having a rough year, unfortunately. But they've also been dealing with a lot of injuries. They play Dixie State this week, which I had never heard of. It's in Utah somewhere. The website's very nondescript about where it's at, but it's really close to a lot of cool places like Vegas and Zion and places like that. So I don't know. I'm going to say they're going to pull it out. They've lost some really close games, so I'm going to say that we have a 3-point win. I'm not going to give a score because I just want them to win and get back on track. And a shout out to Gretna softball. They're the 1 seed in districts. So we're cheering for the Gretna Dragons in the state softball or district softball tournament this weekend. So
we have one winning team. Creighton men's soccer, 10th in the nation, plays Butler tonight in a Big East matchup. Top 2 teams in the Big East. I believe Butler is number 9 in the country in the coaches poll, so top 10 matchup at Morrison, 7 p.m. kickoff. I think Creighton is going to pull out a 2-1 win.
Shootout.
Yeah, for all you soccer fans. Hey, 2-1, it's going to be an exciting game. I think Creighton's offense is kind of coming around, really clicking. Butler's pretty competent on the offensive end themselves. So 2-1, I'll be there. Say hi if you see me. Real quick shout out to Matthew Minner. It's his birthday today. Happy birthday, Matt. If you're tuned in, I told you I'd give you a shout out, so you better be watching.
All right, with that,
signing off. We'll see you next week. We're going to kind of go into more of the cost effectiveness of chiropractic. So if you're interested in saving money and improving your health, then tune in next week. Wednesday, Friday, I don't know. We'll figure it out.
I like these Fridays.
Fridays are fun. So is 5-0. Nebraska.
That's right. See you guys.